Hi, welcome to BariNation, where we support the bariatric community with humor, humility, and honesty.
You've just tuned into a podcast that welcomes you into a community, a resource center, and a safe place that powers your journey towards personal wellness.
Our goal is you leave us today feeling hopeful, inspired, and ready to live your best bariatric life.
Hey, BariNation, it's April. We are thrilled to be officially partnered with Dr. Dovec and her BodyByBariatrics program in Central Florida. If you are a patient of hers or you're thinking about becoming a patient of hers, click the link in the show notes of this episode. You're going to get access to an exclusive monthly discounted rate for BariNation, and you can access and attend all of the support groups, classes, and meetups that we host each and every week in the BariNation membership community. Click that link, and we can't wait to see you in BariNation soon. Hi, friends. Welcome to another fabulous episode of the BariNation Podcast. Today, we have the honor of interviewing two amazing women, Dr. Betsy Dovec and Hannah Schuyler. Welcome, ladies.
Hello.
Thank you, April. Thank you, Natalie. And thank you, Jason. This is going to be a fun one. We have a lot in store for you.
We have a lot in store. We are going to be dropping some top secret breaking news information. We are going to be talking about how we are all working to improve patient access to care.
Yep.
And really just diving into how we can help more people access the life-saving treatment of bariatric surgery in 2025. Because this is the year that we're doing big things. This is the year that we stop putting ourselves on the back burner and we start effectively treating the thing that we have been battling against for years, if not decades.
Oh, yes. 2025 is the year. I think there's so much opportunity, so much hype. I love that mindset. Just really looking forward and creating some goals and achieving them. And I think it starts, like you said, with this very important topic of access to care. Like, what does that even mean? And I'm sure some people are like, oh, this is a boring one. And I hope that you are still listening and you haven't just scrolled past, because it is about a real crisis in our country in terms of the amounts of people who suffer with the disease of obesity and the limited options that are either effective or within that budget. And unfortunately, there is a lot of talk we're going to do about the current landscape of insurance. That's a hot topic right now. And really how that impacts this disease and where people are going, and are they going to Mexico still, a medical destination? So we have a lot in store here, like I said.
Yeah, no, this episode, no matter where you are in your bariatric journey, if this is the very first BariNation podcast that you've ever watched or listened to, this is for you. If you are 5, 10, 15 years post-op, this is also for you. And Jason, Nat, and I are going to share some stories about how our disease of obesity has continued to progress and how we have had to fight for continued ongoing treatment, which is exactly what Dr. Dovec and Hannah are really going to be talking to us today. So before we dive in, we love to kind of give the mic over to our guests. Will you introduce yourselves for people that have maybe met you before?
Sure. So I'm going to do something unusual, and I'm going to introduce Hannah, and she's going to introduce me. So Hannah Schuyler is a registered dietitian, but she is the Swiss Army knife of taking care of bariatric patients in ways that I didn't even know she had in her. She does our website. She's a digital graphic designer. She's a Canva artist. She is our podcast engineer. She's incredibly creative and smart and just a really dynamic dietitian when it comes to all things nutrition. And I tell every patient every time that I introduce Hannah, I said, first and foremost, Hannah is cool, and she's never going to tell you to eat something or do something that doesn't align with your preferences and your lifestyle. And she'll make sure that, yes, you're compliant with our recommendations, but this is not a sentence to have to sign up for bariatric surgery. Hannah really just makes it real and makes it doable. So Hannah's my best work wife, best friend, all things. I love Hannah Schuyler, and I'm so happy that she's on the BodyByBariatrics team.
Well, thank you. Dr. Betsy Dovec is a doctor. Well, that's it.
The end.
The end. No. So, Betsy, as we all affectionately call her, is a bariatric surgeon, if you have, sure you gathered, who has been in practice for 12 years now. And has done over, I'm going to say 5,000 cases. She is the CEO of BodyByBariatrics, the founder, and has dedicated her professional life and most of her personal life to serving this community. She works tirelessly. I can show you the text messages to prove that, and the hours that have been put into making this a space that is safe for people, that is accessible for people, and that's still fun, and we still enjoy ourselves. And like she said, we want you all to continue to still enjoy your lives and be part of this community. Betsy is a community builder. She's also a mom of 3 little Blondini kids who are hilarious, and has a husband. He's fine.
He's okay. He's okay. The big A is fine. You know what? I don't want to do like a standard bio, so expected. I'm Betsy Dovec. Would I start with my college, then my residency? Like, who cares? Like, I want to hear what spice Hannah adds to it. And I'm going to introduce Hannah better than she's going to introduce herself, because that is, I think that's probably another thing in and of itself for another podcast. But how often do other people looking at us do they have a better lens than sometimes we look at ourselves on? So, anyway, but yeah, we're buds. We're fun.
All right. Well, if you didn't already know, you are in for a treat with this conversation. So if you guys are ready, I say, let's just dive in.
Let's do it. Let's do it. Let's get candid. I love a candid conversation.
Let's go. So Dr. Dovec, we've known you for quite a long time. We've known you through a couple of different hospital systems that you've worked through, and now you've made it your life's mission to open your own center, the BodyByBariatrics Center. And we just kind of had questions as to what led you to jump out on it, because that's a big step. That's not just something that you just decide overnight. So what brought you to the realization that you needed to go strike out on your own and open your own center?
So it started back, I was in Baltimore, Maryland for the first 8 years of my career in a small hospital north of Baltimore called Greater Baltimore Medical Center. And when I was there in 2019, now this is pre-COVID, the hospital administration entered into a deal with a surgery center management company called Surg Center Development. And essentially they wanted to build a location that was about 20 minutes away from the hospital, and they needed to bring new business or safe outpatient surgery to that location. We were really busy. And at that time, I led the program, and we were doing about 1,400 bariatric surgeries a year. So a very busy bariatric surgery program at the heyday of it at that time. And we went there, started operating. And the thing that I learned was that this could be done. And actually, when everybody set the expectations that you will go home same day. It sounds nuts because 2019, that was 6 years ago. Not that many people were really doing it. Everyone was staying at least 1 night, 2 nights in a hospital, drains full of catheters. It was scary. It was like bariatric surgery is a big deal. This is invasive. There's a lot that goes into this, including a hospital stay. And then we were doing it. And next thing you know, people were walking out of there within an hour of their surgeries, like walking, peeing, drinking, feeling okay. See in a couple of days, Dr. D, and they're out of there. So I kind of got the learning that I could do that. And now we are opening, the grand opening of the Surgical Institute of Central Florida will be on Thursday, March 6th, 2025. So in just a couple of years, it is happening. And I would love to talk about this journey and what really drives me every day to just keep on going. Just keep on going.
Well, and it's refreshing as patients to hear a surgeon say that patients and access to care for patients is what led you to make such a huge jump, because that's guaranteed salary, guaranteed benefits, all these things you had at your disposal to try to do those things. And then, to walk away from that to serve patients better is not a story that you hear very often in this, in this case. So, it is amazing for us to be able to sit down and talk more with you about this. So we appreciate your time today.
I appreciate you bringing that up. And I think a lot of people are like, oh, wow, that's great. You own this business. And Hannah and I, like you said, every 2 weeks we would get a steady paycheck, and you knew it was coming in. You knew the benefits, great benefits, great package, compensated really well. And then it said, hey, you want to join a gritty startup mode where I don't know how I'm going to make that money or that paycheck to you, but, maybe I'll take out a loan or something to pay. It is. I mean, we talked in our support group recently about stepping out of your comfort zone. Hannah talked about that. And yeah, I mean, it's still really uncomfortable. Like if I showed you like the mortgage payment on this bad boy, you'd be like, why? Why are you so risk tolerant? I do have a really freaky risk tolerance level. Because I just feel like, not to get grim, but all going to end one day. So just YOLO, let's do this here while we're here.
But something else that you mentioned is, Jason, is to your point, like, not only is it, the paycheck and everything, but we learned through this process of all of the other support that those big systems do provide. So the insurance verification, getting you credentials, getting in with payers, getting a phone number set up, getting setting up our emails. Like there is just so much that, Betsy had walked in, and we all did. We all walked into an office and we were handed a computer and we were given a password and they said, go and do your job. And this was there was 6 months before the business opened of this period of time of just hard work, late nights. Again, that's continued, but like it really just shows it just has been this process of what you don't see and what you don't know what you don't know either at that point.
Oh yes, the back end of these things are super fun. It's totes fun that everybody thinks is I think the hard part is we've all made this look so good and so seemingly easy that everybody wants to start their own center and start their own podcast, and it's going to be so fun and easy. And then I think quickly they're going to find out that we just made it look that way.
I mean, the getting a patient from reaching out to us to their surgery, I think they go in our system through 3 pipelines. They get passed from like 3 or 4 different teams that kind of follow them through this journey. And that's without the Google ads. That's without the marketing. That's without the follow-up care that comes with it. So it is this process that, again, we had to create from the ground up, essentially get that.
And I want to jump on that in terms of you guys, in terms of BariNation, and my perspective, being a longtime fan, watching your evolution through all of this too, as business people, entrepreneurs, those just trying to do the right thing because you know that this resource was lacking and that's why you want to build it for patients, by patients. It's amazing to me, like you just said, Jason, like, wow, how far you have come, how you have like this incredible app. Nobody else can ever do this. I don't think so, because it takes just such determination, but you also have to have the level of empathy of actually being a patient. And I've always watched you and thought, man, I have to work with them somehow, because I think, like Hannah said, we all programs, and it's just the nature of the beast. You got to prime the pump, do the marketing, be visible, get them to be a lead, get them to consult, make sure you're tracking them, make sure they attend their final consult, get them to surgery. And unfortunately, patients do have somewhat of the real impression that that's leave them and leave them. It's like, hey, they got me to surgery. I felt like I was just like pushed through there and then there was nothing. So for us, we realize that we can't do everything. And so that's why I think every program in the country, put your pride aside if that's what it is. There's no competition here. I love that you guys have stood true to being agnostic to any program. It's just, again, about support. It doesn't matter who did your surgery, where you did it, why you went here, there, or anywhere. It's about making sure that there is a platform that is, like you said, safe, that offers expert-led and guided real support groups or informational topics, and just giving them the resources, either live or on demand, and what they need. So Hannah and I were trying to one night make this, and we're like, this is janky, man. We need to go with the professionals. Why are we going to reinvent this wheel? So partnering with you guys is long overdue. And honestly, I mean it. I'm not just saying that. What you have done with BariNation, I think it is the most almost hidden gem. I don't feel like enough people know about it and use it. And we hopefully will change that. If you are listening, you need to join BariNation. It's less than $1 a day. Like, no wonder you're like having volunteers run it. You're essentially giving away something incredibly valuable, and everybody needs to take advantage of it if they want to be successful on their journey, period. Because if you do it by yourself on an island, it's not going to work.
Oh, well, thank you for that. I know you don't just say things. We know that. So we know that comes from the heart, and we sincerely appreciate it. Because we have seen firsthand in the community, success. We've seen people start their journeys pre-op, right? They don't even have a date yet, and they're coming to BariNation and asking the questions. And I had this conversation a week or so ago where someone said, I just got to get to the date. And I said, okay, then what? Right? Because I'm on the other side and I can say, yeah, the date is cool. And that's a marker, but then what? And that's where we can have those safe conversations in a monitored community, in a space where this isn't me pressuring you or telling you you're doing things wrong. This is me just being like, okay, and what else? What else can we think about?
Very good points.
Yeah. And it really does take a team. It takes a comprehensive team, right? Jason, Nat, and I, we've all had bariatric surgery. Our surgeons were very skilled. They were centers of excellence. They were MISWQIP. I think I butchered that, but right? Like they had everything that you as a patient want to look for. But where we felt there was a lack in pre and post-operative care and support, we created it ourselves because we knew that we could do it. And where BariNation, I think, has really thrived is in these partnerships with centers and surgeons just like you and professionals just like you. It's because when those two worlds come together, you acknowledge, I can't do what you do, and there's some things that we do that you can't do. But when we team up in the interest of patient holistic care, we are going to thrive, even when this journey feels impossible, even when things get difficult and challenging and dark. When patients know, not only can I go to my surgeon and that care team, but I have this safe community that I can also tap into 24/7 a day and not only get the support of peers, but really those credentialed experts, right? Like support groups led by bariatric therapists, classes taught by registered dietitians. That makes a difference. And I think all of us on the screen believe that is the future of patient care. It's why, right, you both reached your tipping point and you were like, we think there's a different way of doing this. And we want to explore what that's all about. It's huge. It's brave. It's bold. It's a big risk, but it is in the service of patients everywhere. Because if that improves access to care, that means more people are going to be healthy, whole. They're going to start treating a disease that they probably never treated before. They're going to be introduced to people that truly care about them as a person fighting a disease. And they're going to tap into a community that's there for them no matter what. When those things come together, it is tectonic in the best possible way. It is changing the landscape of somebody's life forever.
Wow.
And that's what this is all about.
Oh, so powerful. So true. What a way to say that.
Yeah.
I mean, I say it like strangers become friends. I'm obsessed with that, but I like that tectonic. Hannah, jot those words down that she just used to describe what's happening when you really dive all in and you get vulnerable in this community. And I mean, BariNation, obviously there's nothing else like that there. Yeah. I kind of thought about you in this. I go on vacation I do take time off and things, but the whole time I'm thinking about
no, she doesn't.
I know. I'm just like, Hannah, she's like, go away. I thought I was going to get a minute. I'm at a beach, but I went to Costa Rica, and I always joke when I actually have time to do nothing but really think about things. I was at a beach in Costa Rica, and it was not touristy. It was just like this, like kind of like raw beach there. And I was sitting there and I'm like, we are not doing a good job on the aftercare side. And I was kind of texting with Laura Graybo, our fabulous friend and bariatric therapist, very experienced on the mindset piece in the community. Just such a great perspective. And I'm like, how do we incorporate her into our practice? And so it was at that trip that we kind of sketched out in the notes section of our phone, this Project Reset thing. And that incorporates mindset, movement, meals, and motivation. And they get all these things and weekly small group, kind of cognitive behavioral therapy strategy sessions with Laura. And they get meal plans from Hannah and they break it down, all this great stuff. And then it kind of ends. And we realize that people are like, wow, I'm starting to turn a corner. I'm learning so much. And that is when I was like, no, this has no beginning. It has no end. This is a journey. And Income BariNation, I need to talk to April and bring in Matt and Jason, and, the rest is history. And here we are in the podcast. We're talking about all of these things that we are doing that I can tell you firsthand. And so can Hannah, how many of our patients are already in this Project Reset grad group, or they just joined. You don't have to be in Project Reset to join through the BariNation kind of BodyByBariatrics affiliate link. But patients are doing it and they're attending the sessions. And I mean, the feedback is so awesome. And you're like, I want to frame these little like sound bites that we get. They're so good.
Yes.
Yeah.
We think about that all the time. The patient feedback, right? The member feedback for the BariNation support community. And the other thing that we wanted to touch on, Betsy and Hannah, we would love both of your feedback. What things were you hearing from your patients in those previous practices that, you're bringing or making sure to address during this time in BodyByBariatrics? Like how are you kind of taking what you've learned and applying it here?
Yeah. Hannah, do you want to go first?
I would say, sure. I think that, kind of like you touched on earlier, a lot was with the insurance. That was something that's such a big issue. And, we definitely have worked with being able to operate at these outpatient centers, bring down the self-pay rate so we can help people that are, not able to get this covered by insurance, but maybe still make it manageable within that. I think from my perspective, thinking about kind of you mentioned a little bit about this, Natalie, like the period before and leading up to surgery. And there is so much emphasis on that. There's so much emphasis on from the insurance companies and from, we're educating and we're doing all of this. And, this was something else that Betsy had done years ago was NutriHealth, was because we felt that emphasis on that pre-op nutrition was so important. And then they become post-op and there's just nothing it's just poof, and as the dietitian, you're getting burnt out doing this education and whatever. And so really trying, in my perspective, to help patients to shift from, yes, the pre-op education is important and you need to know what you're getting into and blah, blah, blah. But realistically, you guys can attest to this. You don't know what it's going to be like until you're living it. And so really that support is where that needs to be. So I think that was something that, I had heard. And so making myself in this role be more available for those one-off questions or those little things. People text me questions all the time, and just having that availability. I do open office hours. So once a week, I'm just in my Zoom hanging out and people can pop in. So just that access to, like you said, a professional. And again, I think that's where BariNation is great, because you guys have the dietitians, and I trust my colleagues who, sure, we may do things sometimes a little bit differently, but I'm sure that they're giving great advice out to the people and to the members and supporting them on that lifelong journey. Because realistically, pre-op is like a blip on the radar of time. Yeah. You are in weight loss phase, and then you are in maintenance phase for the longest period of time. I mean, I talked to somebody who was 23 today who's getting ready for surgery, and I was like, we got to make sure you're really primed for maintenance, because you've got a lot of years of maintenance ahead of you.
And from our live patient experience, maintenance 6 months out or 1 year out is very different from maintenance 18 months and 24 and 30. Like the further you go, move out from your surgery, it looks and feels completely different. And when you think you're rocking and rolling, life throws you a curveball, and you need to mix things up. As we talk about often on this podcast and in BariNation, obesity is a lifelong and chronic disease. And it almost takes you as a patient getting to that point where that lifelong and chronic really actually hit your life. Because at that point, you really understand deeply, oh, okay, this is what this means. And if your surgeon is not kind of your partner in crime through this is a part of the access to care discussion. You either need to re-engage with that person or you need to find a new one. Because these are conversations that you have to have. You have to have dietitians and professionals that you trust in your life to go, okay, I know we talked a year ago and this was going great. And now all of a sudden this has changed. Yeah. You need those people in your life. And if, right, it is not affordable for you because insurance doesn't cover it, you have to be able to go to a place where you can get that expert support, which is again, why this partnership between BodyByBariatrics and BariNation is so powerful. For $29 a month, you can attend registered dietitian-led classes 3, 4, 5 times a month. And then if you are still involved with your surgical center, you have that as well. Access to care can be such a scary thing for patients because we tell ourselves, this is going to be too much work. I'm going to say the wrong thing. I don't want to call the insurance. They're going to tell me no, right? You build the snowball of worry and doubt. And if you put your head in the sand like an ostrich and don't engage with this journey, you are going to find yourself right back to your starting point before surgery. And that's scary. None of us want that. And that's why this access to care is so critically important.
Completely agree. And, if I were to really simplify why or what I really wanted to do with a private practice and having the autonomy to practice medicine or give an experience the way that we visualize doing it versus being an employee of a hospital. The simplest thing is being able to communicate. Hannah said, she doesn't mention it casually. I'm like, man, though, that's the major thing. It's texting. If you text me 7 days a week on a Sunday we have kind of like a group chat almost, we can see it. You will get an answer 7 days a week. I mean, there are maybe moments it won't be like instantaneous, but I think that there is nothing more frustrating than when you need something faxed somewhere or you need, can the doctor sign this? Or, can you send over that psych eval? Like, did you send it yet? Did you get it yet? It's so slow. The administrative burden associated with it. So we really try to make it like white glove, very frictionless, really easy. If you want to do this, let's cut some of that red tape and make it so that you can get the care that you want to, on the timeline that you want it. So if you're ready like yesterday, let's do it. Like, I don't think there's anything special about waiting 6 months or doing 6 months of supervised weight loss. You have been thinking about this for probably the majority of your adult life, if not longer. So what's another 6 months? What's 3 months? What's 1 month? What's 1 day? Who has the magic answer? No one, except for the person who knows that they're prepared and they're ready for it. And then let's do it.
Did you guys have to go through 3, 6, 12-month like pre-op programs? What was yours?
I had to do 6 months pre-op and I had to lose 50 pounds in order.
That's punitive.
That is punitive.
I did it.
That's great. Yeah.
But still.
There's people that's not possible for. They have tried to lose weight. I talk to them all the time. I've tried to lose weight. I talked to somebody today who's postpartum and can't lose weight. She's she couldn't lose 50 pounds without help. And that's why she's with us. So anyway, I won't jump on that soapbox right now, but
I know. It was hell, honestly. And I did do medical tourism. So they do things a little bit differently. And it was very by BMI. It was, So it was a lot more rigid because it is like outside of the US in that respect. But yeah, I mean, I remember thinking like, okay, I guess I'm doing it because it was COVID and I was like, I can't go out and eat all the time. So I guess I'll just like stay at home. And
Wow.
but yeah, April and Jason, I've told so many horror stories. I met them during my pre-op. So I'd like
Wow.
really like thank the heavens for Jason and April because they got me through.
Yeah, I was a 6 month program pre-op where I had to go. At that point, I was actively dying. I was told by my primary care physician, so I was in such poor health, I was going to visit her every week. I had a standing appointment every week to go to her office and make sure that I was, not that today wasn't the day I was checking out. Oh. And I had so many appointments where we had talked about exercise and diet that when I went to load up, they were like, well, you have to have 6 months consecutive visits to your primary care where you talk about that. And I'm like, oh, I have that and then some. Well, I sent it over to my doctor and they were like, well, we don't really have, or to the insurance. And they were like, we don't really have the specific notes like we want them to. So if she can send notes on these two, we'll take these two along with this other two. So you still got to give us, more. And I'm just like, geez. So I ended up having to go back for more, just to finish it off to get it done. But I still had to wait, after I had finally made the decision, because I've been grappling with it for about 5 years on whether or not I was really going to have it or not. So when I finally made the decision to have it, then having that extra hurdle on top of that almost made me pull the plug on it.
That's why they do it.
I was sitting there because the whole part to the Baptist Center that I went to here in Jacksonville was you had to watch the webinar first, then you had to call them back and let them know that you watched the webinar and that then you could go set up for a consultation. So I watched the webinar 4 times over about a month and a half period. I watch it and I'd be like, yeah, I don't know. Or I'd start it and not finish it and watch it again. Yeah, I treated it like a damn miniseries. And then finally, I get through to the other side of it and I call and they're like, well, yeah, you can come in for a consultation and it's going to be a few weeks. And, you get through the thing and I'm just like, it really like when and that's just kind of the part that they don't understand not being on the patient side is that when we finally get the guts to make this decision, we don't need the hurdles. So it's just those little things that I wish more providers knew that, those roads kind of need to be cleared off so that we can kind of make it to the table. Because a lot of times I'm sure they lose way more patients that just decide they're not going to deal with it.
Oh my gosh. You figured out their business problems and like their operational flow deficiencies by instituting arbitrary and nonsensical things and giving inaccurate information to the patient because, well, that's the way I think Aetna always does it. What did you check today? The policies change pretty much on the daily. Did you check? Are you making them do things that they don't need to do? Like all of those details matter because like, why waste someone's time? We see that all the time. Hannah and I just are obsessed with that.
Yeah.
And again, if you are a patient and you are pre-op and you're listening to this, our message to you in this moment is persevere. Keep going. Do not give up. Do not give up. Stay the course. What are you doing now in your center that is allowing people to access care on a faster timeline? How are you doing that?
Well, like Hannah said earlier, we are able because you're looking at a hospital compared to a surgery center. So let me break this down. If you are a patient, let's say you're going to have a gastric bypass. There are 3 major entities involved with this. Number 1, there are the professional fees, the surgeon fees. So that would go to something like us, BodyByBariatrics. Then there are the facility fees. This covers things like your equipment, the overhead, the staffing, everything that goes into that. And maybe if you're in a hospital, it also includes the overnight hospital stay, any labs, imaging, SCDs, medications, all of that. And then finally, there's the anesthesia fee, and they're separate as well. So there are these 3 separate entities. It's called fee for service. So all of us have individual, completely independent contracts with the insurance companies. So they'll pay us a certain percentage of Medicare allowable. So let's say we get 105% Medicare allowable. Great. That's my fee. And it doesn't matter if the facility is getting 400%, for example. When you look at that, it's expensive versus a surgery center where it's lean. You have a leaner staff. There's smaller ORs. You're more efficient. Your team is all incentivized to get going and get out and do safe surgery. It costs a lot less, huge discrepancy. So because of that, we are able to charge a total amount that's much larger for self-pay. If you have an exclusion to bariatric surgery coverage, or if you have an employer, we can actually contract directly with employers so that they can carve out that bariatric coverage. They can bundle it up. And then we will take care of their employees almost exclusively. And then there's the payers. And ultimately, this is where the work comes, but we're on the tip of it, and this is going to happen. Right now, we might be somewhat of the pioneers of pushing bariatric surgery to an outpatient space. These codes are going to come off of that inpatient-only list. They're going to come off. And then at that point, we're off to the races with these conversations, these negotiations with Blue Cross Blue Shield, Aetna, Cigna, United, because they're going to wise up and say, why am I going to pay for the same surgeon, the same anesthesia, the same care, the same quality in a hospital when I can get it in a surgery center? And actually the experience is better too, because you're at home or you're in a hotel that you're recovering your own environment. You have the ability to give yourself the pain meds, the nausea meds. You have everything set up and organized because you're prepared. Your expectations are set and you're going to do better overall.
As a patient, you don't understand any of these back end things, right? You literally make a phone call to your insurance company and you say, do I have coverage? Do I not have coverage? And then you're given a list of people to reach out to. But if you understand kind of these back end processes, we can spend more time on our back end as patients, really truly exploring those options.
Mm-hmm. It's never a no. It's never over. Yeah.
Yeah. And I think from a process side of things of like, how do we actually also get patients moving more quickly through this process of, we're not doing a lot of 6 month, 12 month, anything like that. We're going to follow, like we do see insurance patients and all of that. And we're going to follow what the insurance company says. But we're not going to arbitrarily make rules that apply to every single patient. So while, yes, I have a couple patients that are requiring right now 6 months of supervised weight loss visits. And so I see them, they see their surgeon in month 1, they see me 4 months, and then they see their surgeon in month 6, and that's their 6 months. And so we do that for those patients that require it. But if it's not in your insurance policy, we're not going to make you do that. We're not going to just give you this program. Again, like Jason's point, like, we need to fast track. We need to get these people, because the moment that they sit down and they're vulnerable enough and open enough to tell us, I'm ready to pursue bariatric surgery, we got to hook them. Because again, I interjected earlier and said, this is their model. This is the insurance's business model. That's what I believe, is that they put these guidelines. A lot of them, like Betsy said, they change all the time too. And some of these programs they're just doing it the way we've always done it, right? And they never update it. And that is where I think that is one of the places that we stand out, is we're not just going to do it the way it's always been done for any reason.
Mm-hmm. Well, because I think about the people that are dealing with the insurance companies that just do the initial decline anyway, just the initial decline, see if they'll fight for it, see if they'll come back, because a lot of patients they don't know to fight for it. If they get most people don't know how their insurance works. So if they get an initial decline, they're just like, oh, well, they said no. And they don't know to stand up and fight. So it's awesome to see that you guys are looking at it from a standpoint of fighting for the patient, because it's so often times that we're just left to our own devices. We just want the help. Like, that's all it is. Yeah. We're grasping at anything, any kind of help we can get, because we're legitimately drowning in our own obesity. And without that life preserver, like, we don't have a way out, and we just grasp for whoever can help us out. And if the insurance is just like, yeah, no, we're good. We don't know that we can fight that.
Mm-hmm. Yeah. And I mean, once you submit it, if you get a denial, that means mommy's getting ready. I'm getting warmed up. It's time for peer-to-peers. Let's do this. And I love a good medical director. Because a lot of them, they're not specialists in bariatric surgery. I mean, I do one thing over and over again. Like, you're not going to come at me with something. I'm just going to I'm going to win. I want to win it. And I never let it go to appeal. I know that that's a dead end. It's like they just, I don't know what they do with that piece of paper, but they don't do anything with it. It never gets overturned in the appeal process. So you can't let it go there. You learn how to do that. So if you're listening and you have been told that you don't qualify or that your prior authorization request has been denied, let me have a stab at that, because honestly, I would love to speak to a medical director on your behalf. And honestly, this is weird, but some of these medical directors that I've spoken to so many times over the last decade plus, I've kind of become friendly with. It's like, Chuck, how's Pittsburgh? And then I have another one that, she had a West Virginia number, and that's where I'm from. Anyway, I could go on, and it's just like, how are the kids? Okay, well, let me talk to you about this case. You're going to help me out, right? And, I mean, they even know it's all nonsense. It's nonsense. So yeah, you like Jason said, you've got to fight for it. And there is a lot behind the scenes that we have learned through our experience. And we have a whole army of people who do benefit verification, prior authorization, surgical scheduling, obtainment of your pre-operative medical clearances, all that stuff, logistical stuff to do a 20-minute sleeve. My God. But we got it, and you're going to get it too. So we're going to make it really easy on the back end.
I think what's so inspiring for us from the patient side of things about this conversation is practitioners like yourself and others are looking around going, this has to improve, right? Mm-hmm. Patients have to be able to access this care. And you are seeing a different pathway to offer it. And right, from the patient side of things, we have insurance, right? There's things that we have to do, but to know that there are options out there. And that once you have reached that tipping point in your own life and you say, I am going to have surgery, the world opens up a little bit. And now, because of these opportunities that you're creating, the center that you're opening, there are even more opportunities out there. Yes, it is going to be work. You have to put in the effort to understand what path is going to be best for you. But there are professionals, there are surgeons, there are teams, there are centers out there that want to actively partner with you in that. Not because they see you as a business opportunity, but because they see you as a patient in need of care. Mm-hmm. And we all have the right to live life and to not suffer. Mm. Access to care is, I think, all of our bold predictions for 2025. We see it really changing. We see surgery kind of coming back online as the preferred treatment for the disease of obesity. We all see centers like yours being that pathway forward into a bold new kind of era for obesity medicine care and treatment.
Yeah. And I think that when you're looking at it from the perspective of the payer, whether that be the employer or from the insurance companies, they have to pay money, whether that be at a hospital, more substantial amounts, or in a surgery center, whatever it is, it's still tens of thousands of dollars. We know this. Even if you're self-pay, you're going to pay most likely 5 figures plus, probably somewhere in that ballpark. But so it's a big investment. So you have to look at it from their standpoint in how do I protect? How do I ensure a return on that investment? How do I do an ROI? And this is where I think, like you said, in 2025, things get very interesting for BariNation. Because when we go to these people, sometimes their policies we definitely think are just, put in place to be barriers, oppositional forces. But sometimes, all right, the patients are going through it and they're like, man, they just gained their weight back because, well, maybe we should institute more time, more psych evaluations, more clearances. So they're trying to, again, protect their ROI. So if you could have a proven program like you've already developed, where it's not so much about this arbitrary kind of a piece of paper on a one-time psych evaluation. What are you going to learn about yourself in that time? It's about ongoing therapy and really diving into this whole process. So I think when you do that, when you really look at it from, I am all engaged in a program that works, and you show the data. They're all obsessed with the analytics. Just show me objectively that this is the best way to go. Yeah, I think that you should require something like BariNation. Flip it up. Change your policies to do something that will actually work. Because if you look at the last time a lot of these policies have actually been touched was in the 1990s when the NIH put out like a position statement on, all right, well, we can't just do surgery. We should do something. And that was the last time that a lot of these like curriculums and policies were really looked at these outdated NIH policies, looking at the BMI requirements and those sorts of things. I think it's time for a fresh overview. But I also think that if you sit back and just kick the tire and think, you know what? This is wrong. This sucks. They're terrible. They're just denying me, instead of going in there and say, can I have a meeting with you? How do I get the right person in the right room to show them what we are capable of, and to show them that bariatric surgery should be far more successful than even medical weight loss, because the ROI happens much sooner. It's much more cost effective, and it's just much more tolerated. And it's overall, it just works. It's the best treatment that exists to treat this disease. So we need to make sure everybody knows that, period.
Period. Put a
T on that thing. Period. T, whatever that is. Like the rappers say.
Don't ever do that again.
Okay. Keep that in or take that out as you will, BariNation.
Oh, it's staying in. It's staying in. There's no, yeah. That's executive decision there. This is what is required if we want to use Dr. Ann Rogers' words at last year's ASMBS, or at one of the corporate council meetings we were just at. How are we going to move the needle? How are we going to move the needle? And she's looking around, and I think she is so frustrated at seeing status quo. Mm-hmm. And yet obesity rates are skyrocketing. GLP-1 medication sure is helpful, but people are losing access, gaining access. Everything's changing. Nobody knows what's what. It's compounded. It's not. And the answer has always been in front of us, and that is metabolic and bariatric surgery. Why are we straying from this? If we want to move the needle, we need to have more conversations with more people who are suffering. We need primary care physicians to write a referral during that appointment to say, you are suffering from the disease of obesity, and I'm referring you to an obesity medicine specialist. I'm referring you to a bariatric surgeon. We need more bariatric surgeons saying, yeah, this is a nightmare to sometimes get through. How can I partner with you to help you jump through the hoops? How can I connect you with organizations, right, with peers that are going to help you through it all? And how can I be that holistic partner for you? Because I can do one thing, multiple things really well. I can move you through surgery. I can help you with the education, but you're going to be dealing with this for the rest of your life. And it's always been there. And especially now, it's there. Mm-hmm. But we're talking about the same things that we were talking about 15, 20 years ago.
Yeah.
And what I'm hearing from you, Betsy, and Hannah is the autonomy, right? Of like pulling back that insurance veil, if we want to use that metaphor, but like giving back the autonomy to the patient and saying, and that's why BariNation, the support community, works so well. The podcast works so well. We can give patients, as patients, the autonomy to say, no, you have to ask for this, or these are the questions that we asked during our pre-op stage or a month post-op. This was my experience, so that they know that either it's normal or that they should be asking questions and reaching out to their teams. And what you all are giving patients is, yeah, we get it. We're small. You can text us at 12 in the morning. We might not answer it right away, but we'll answer it as soon as we wake up, and having that autonomy to ask the questions and to get curious and to find care that actually works for them. And I think that's what's really going to move the needle. But we have to take that veil off of bariatric care, because it's there. It's been there.
Yeah. But again, hopefully you're really leaving with this. You are worth it. You deserve treatment. No other disease on the planet is so vilified as obesity. This is not your fault. This is a disease like every other disease. And the sooner we can help you access care and treatment, the better your life will be and the better our life will be, because we need the best version of you showing up each and every day. And the disease of obesity is preventing the best version of you from doing that. So everybody on this screen is here to help you. get access to the care that you need. Last question, Dr. Dovec and Hannah. Tell us a little bit about your grand opening that's happening.
Yes.
Oh my God.
Yes. Thursday, March 6th, 6 p.m. Eastern. If you're in the greater Orlando area, we would love for you to stop by. You can find all of the very public invitations. There's so many of you who have watched. I have been inspired by your journeys, and I hope that you are inspired by mine. I think that there are a lot of parallels in chopping that Everest climb into these daily things. And the next thing you know, you're standing up there at this, at the summit, and you're like, oh my God, I climbed this and I did this, and I know the work is just beginning. And I can't wait to celebrate that at this grand opening. It's like I'm throwing myself this big bash, but it's not for me. It's for everybody that's had a part in it. Hannah will be right there with me, arm in arm, with the patient and with my colleagues and mentors and friends and family and my husband and my 3 kids and everybody who has allowed me to do this and the sacrifices they have made.
You deserve every moment of joy and celebration that comes with this. You have dedicated your life to making better and treating a disease that is outside of people's control. And this is your moment to shine. You have put it all on the line. You have made it very clear what you believe in, how you see the future of care progressing. And you have sacrificed a lot to make it happen. It is a bright and bold future for both of us. And we are just so thankful for your support. Dr. Dovec and Hannah, you guys have really been in our corner since the beginning. And we could not have done it without your constant support and belief in us as patients. You really were one of the first professionals that point blank said to us, you guys are doing this well. You're doing it right. And we believe in you. We were floored because you, I think, really were one of the first. And for patients who have been told your entire lives, you're not smart enough, you don't know what you're doing, just sit down and be quiet. It was the fuel in our fire to keep it going and to say, you know what, we are onto something. We deserve better.
That is awesome. Thank you for sharing that with me because it's all true. You're getting bigger and better.
Yep. Together, we say it often, right? Apart, we're smart, but together we're brilliant. And we really can do some amazing, bold, brilliant things when we work together. Dr. Dovec, if people want to connect with you, if they want to learn more about your amazing surgical center, your Project Reset opportunity, or the amazing partnership that we have with BariNation for that discounted membership rate, where can they go? Where can they find you?
The easiest is our website. Made by Hannah Schuyler right here as we started with, we're ending with. It's BodyByBariatrics.com. I'm also on Instagram at BodyByBariatrics.com. You can find me individually at Dr. Dovec, DRDOVEC. Follow me, slip into my DMs. I'll write you back. I personally respond to every message that I get. And so does Hannah, hannahschuyler.rd. And then she's on there too.
The Surgical Institute at the Surgical Institute on Instagram. So if you want to get updates there, you can do that. And then I'm going to do a little plug for our podcast, if I might. We're the Weight Loss Collab. So check us out. Same thing at the Weight Loss Collab on Instagram, or search us on your favorite platform. We have a lot of episodes, lots of topics. We're always getting back on track with it. So we'll put out new ones, we promise, but check us out there as well.
You know, one thing at a time, you're opening a giant surgical center, and we will make sure, friends, all of those are linked in the show notes below. So if you want quick and easy access to all of the things that we talked about during this episode, just open the show description, scan to the bottom. Everything will be linked there. Dr. Dovec, Hannah, thank you so much for joining us tonight. This is an amazing conversation, and we appreciate you both.
Oh, thank you guys.
Awesome.
It was awesome.
Thank you guys so much for having us.
Super fun.
That wraps up another empowering episode of the BariNation Podcast. If you enjoyed today's episode, keep the conversation going by joining the BariNation membership community, where you can attend live support events, access on-demand resources, and find a caring community.
Join us at BariNation.mn.co. If you found this podcast valuable, help us produce it by becoming a $5 monthly supporter at BariNationPodcast.com.
And just remember, at the end of the day, you've got this, we've got you, and we'll see you next time. Bye, everybody.